Today's lecture is the cell wall inhibitors, and cell wall inhibitors are the most safe antibiotics available, largely because of the penicillin. And the classification includes the following drugs. One moment. And the penicillins are the penicillins are the most uh, widely used ones, including amoxicillin. Amoxicillin is most frequently used because of the low potential for the GI disturbances, and ampicillin is also available. And so for the nitramycin, Busha, I'm not sure. Also, nitramycin. So no, it's we will not study it. We will study it later. So it's not today. But still, I will send you the detailed paper.
Yes, yeah, I just give you the name. Just
Okay, good. So uh, the other penicillins like penicillin G and V are seldom used because they are mostly injectables, like penicillin V is injectable, and then naftalin, oxacillin also rarely used. So, but we will get to that later. So these are penicillins. Also, piperacillin and ticarcillin are the anti-staphylococcal, sorry, anti-pseudomonal. So we will talk about them too. But mostly you will use amoxicillin. So amoxicillin is actually the primary penicillin available today. Then the second group is cephalosporins, and cephalosporins are huge group and four generations. So we will talk about that later too. Carbapenems are usually reserved for the serious infections, hospital infections, as well as the aztreonam. And then also there are some combination with the clavulanic acid, and so combinations with the beta-lactamase inhibitors, and then also other new antibiotics that usually also reserved for serious infections, including vancomycin and other or its derivatives. So this is a classification. Please learn this by heart. So the penicillins have a common structure, and they have uh, 6-aminopenicillinic acid in their structure, and this is beta-lactam ring, that is this 4-atom ring with nitrogen and oxygen. So this beta-lactam ring is essential for the activity of the drug. And also this bond is cleared by the bacterial penicillinases or by acid, and that will destroy the ring and also the activity of the drug. So the another ring that is fused with the beta-lactam ring is 5 piece of 5-atom ring with a sulfur, and there is a acetic acid uh, uh, derivative here and 2 metal groups. So also the amine group is on the left, and then this here there will be some radical that will determine the stability and also the antibacterial spectrum and acid resistance also. So this is the structure, the chemical structure of the penicillins, or actually 6 amino. So 6 amino because amino group is in the 6th position, and this is a penicillinic acid because this is acid here. So this is actually 1 2 3 4 5 6. So 6, this is the 6th carbon, and that is why amino is in the 6th position. And then there is another one group that is there, and the mechanism of action of the penicillins is based on the interference with the synthesis of the peptidoglycan, and peptidoglycan is the structural component of the cell wall. So like bacteria have a cell wall additionally to the cytoplasm, so to the cytoplasmic membrane. So the animals and humans, they don't have the cell wall, they only have the cell membrane, but bacteria have a cell wall, and especially gram-positive bacteria have a very huge cell wall with an N-acetylmuramic acid and N-acetyl glucosamide, and these structures are connected to each other using the peptidoglycan. So, and these are actually the penicillin binding proteins. So penicillin binding proteins will connect the N-acetylmuramic acid and then also N-acetylglucosamide. So the synthesis of these blocked by the penicillin and other cell wall inhibitors, and this is the mechanism of action. The antibacterial spectrum of the natural penicillins, including penicillin G and penicillin V, will cover the gram-positive cocci, the Streptomyces pneumoniae, and Streptococcus pneumoniae. And Streptococcus pneumoniae is a primary cause of the bacterial pneumonia in adults and children. So the resistance to the penicillin is very high nowadays, so that is why penicillins usually don't use for the pneumonia. So if the pneumonia is diagnosed, especially in the hospital settings, it will never used for the treatment of the streptococcal pneumonia. But if it's diagnosed at home, so and patient is outpatient, then you can try to treat it with the penicillins. Then
Sir?
there are two.
Excuse me.
Baha, I
Why?
will answer later. We have a lecture.
No, sir, it's me, Mustafa. I just have one question.
Sure.
It's forbidden in Russia to give amoxicillin and because it's have penicillin?
Amoxicillin and what?
The group of amoxicillin it's forbidden to give in Russia.
The goal?
They don't give it without receipt of the of doctor
Okay.
because it have penicillin.
No, because it is antibiotic. So
I know,
actually,
but
yes, the amoxicillin is a penicillin. It
yes,
does not have penicillin. It is itself is a penicillin.
yes. And why it's forbidden? Because it's from penicillin.
No, it is forbidden because it is antibiotic. All antibiotics are prescription only, so you need a prescription for
Ah,
them.
okay, okay.
But there are some pharmacies that will dispense without prescription. If you
Mm-hmm.
like, uh, actually, if you order online, you usually don't need. They will not require a prescription. So,
Okay.
and many pharmacies today uh, make pre-order is available in many pharmacies. So you can pre-order online then, and when you uh, arrive at the pharmacy, you tell them the order number, and then we'll dispense. So, so this is mostly for those patients who use drugs regularly. So, uh, and like if you know how to use the drug, like you was prescribed before, and then if like you cannot visit the physician a second time because there are huge lines now during the quarantine.
Mm-hmm.
So
Okay.
then they usually dispense it without prescription, especially if you pre-order.
Okay.
Uh, but after this lecture and after this course, generally all of you could be able to prescribe yourself. So
Yeah. Okay.
because in most countries pharmacists prescribe too, like in Russia they
Uh,
don't prescribe, but as far as I know, in France they prescribe also. There's some there is a
in
list
our
of.
country, it's the same, sir. They can describe for the patient.
I see, but in most countries there is a limited list they can prescribe too.
Yes.
So actually that means that don't afraid to prescribe, because like uh, uh, like your knowledge is enough. But so if you complete this course and understand what is going here, then it will be easier for you to select the drug, to select the optimal antibiotic for the treatment. So this is what we are learning, so teaching here to select the proper drug for the treatment. So once you have your diagnosis from the physician, then you should help the patient to select the more appropriate drug, because even some physicians are not very good in that, because they prescribe the same for all the patients. Like
Yes.
like most of the physicians even overprescribe the antibiotics, and we will talk about
Yes.
that too. So
Okay.
okay, let's
Thank
return
you.
to the pneumonia. And actually, besides the pneumonia, that the another streptococcus infection is the Streptococcus pyogenes and Streptococcus viridans. So pyogenes will cause the increased the high temperature. That is why pyogenes, like pyo in Greek means the hot, and the viridans are actually different groups that can lead to the skin infections. So then the Bacillus anthracis is the uh, very rare nowadays, because it's very uh, serious disease, will lead to the death, and that is why uh, the there are not so many sources of this infection. So anthrax is actually very uh, deadly, so it will lead to the death. So that is why there are only two places in the earth with this bacteria left. So that is why you will probably not see this in your life. So Bacillus anthracis will lead to the anthrax. And then diphtheria is very common. Corynebacterium diphtheria will lead to the diphtheria, or is actually a GI disease, and bacterial disease that will lead to the GI problems. So diphtheria is common in children because they don't wash hands. So, but in adults usually not a problem. So usually adults will only have this diphtheria only if they contact with the children. So if they are working in the kindergarten, or they have relatives with the children, or they have children themselves, so this is usually the only case. And then the gonorrhea is very common in the adults, and actually one of the most common diseases, infectious diseases in adults, is gonorrhea and syphilis. So the reason is that they are transferred with a sexual transmission, so they are transferred during the sexual intercourse, and that is why Neisseria gonorrhea is actually mostly seen in the those professions that actually so the professions that sell the love. So and gonorrhea is easily treated, but can lead to the return. So sometimes it's seen after the treatment again. So Neisseria gonorrhea is usually seen only in the night working professions. So then the Neisseria meningitidis is usually not transferred sexually, but it will lead to the meningitis, and also treated with a cell wall inhibitors, but not with the penicillins, because penicillins will not readily enter the central nervous system. That is why usually penicillins are used only for the gonorrhea, Neisseria gonorrhea. And also the newborns will have a gonorrhea that of the eyes that is called blennorrhea in the children, in newborns, because they pass through the uh, uh, through the birth giving ways, and they can, that will lead to the obtaining of this Neisseria gonorrhea. And to prevent this, the silver drops are used for the eyes just after the birth of the children, of the child. And the also the to prevent the fungi diseases of the nails, the acid is used for the nails. So when you dispense for those purposes, make sure that the labels are different, so the midwife will not put the acid to the eyes and silver to the nails, so vice versa. So make sure that the labels are different, and make sure they will not they can easily distinguish. So then the Clostridium perfringens is the anaerobic. So this actually gram-positive, Streptococcus, Bacillus anthracis, and Caneurobacterium diphtheria, and then gram-negative or Neisseria. So this like microbiologic classification is gram-positive and gram-negative. Then anaerobic is like can survive without in the fluid without the oxygen. And Clostridium perfringens is usually seen in the intestine and will lead to the cramps in the stomach, very painful cramps. So if patient will have a or like usually an analgesic is required to reduce the pain, and this is actually also very like very hard disease. So but anti pseudomonal, so the actually penicillins are good for that. So and then the latest but not the least, the last but not the least one is Treponema pallidum, and that will lead to the syphilis. Syphilis also is transferred with the sexual way. So and also the second highest the second common disease after the gonorrhea. So gonorrhea is the first one, and second one is syphilis. The good thing is the syphilis will not make a resistance, so penicillins are always effective against the syphilis. So and as a venereal disease is transmitted with the sexual intercourse, not necessarily the vaginal. Any oral sexual intercourse is also enough, and it will affect many tissues including skin, hair, and the sclera. So and so this is actually easily treated with the penicillins, but secondary syphilis is also common because the treatment is not complete. Questions?
No, there are no questions.
Okay. So then that is the antibiotics spectra for the natural penicillins. Natural penicillins include penicillin G and V, like only these two, penicillin G and penicillin V. So once you remember, so when you after the lecture learn this by heart: gonorrhea, pneumonia, syphilis. So and all these organisms like bacilli, cocci, and anaerobic and spirochetes. So Streptococcus pneumonia you should learn by heart. Bacillus anthracis you should learn by heart. Carinobacterian diphtheria you learn by heart. Neisseria gonorrhea and meningitis learn by heart.
Actually, we had it before. All this bacteria.
You know by heart this, all of this.
Yes, from microbiology.
Good.
Yes.
Now you should learn
Streptococcus vacillo. Yes.
So now, like, what you should learn that they are treated by the penicillins. Like when I ask you what is the antibiotic spectra of the natural penicillins, you should list all this. Okay. Good. Then
okay.
so now when you know that what is what you should learn by heart, so let's move to the next slide. And this is a stability in the acid, because the after oral administration the penicillins should pass through the what someone is praying or singing, so in Arabic language. So it's very beautiful. So
الصوت علاء.
song.
No, just told Allah to close the sound.
It's Quran.
Quran. Oh, that is why it's so
No,
beautiful.
it's Quran. Just
Quran.
yeah.
Quran.
Sorry.
So it's beautiful,
yes.
very beautiful. So the natural penicillin will be destroyed in the stomach, because the penicillins are not stable in acid, and the stomach acidity is very low. The pH is about 4 during the meal. When you are taking the meal, the acid is reduced much, and that is why the natural penicillins will not survive unless the dose is very large. And then the antistaphylococcal penicillins are acid resistant. So this is dicloxacillin, methicillin, nafcillin, and oxacillin. The methicillin is currently not used because it is toxic. So methicillin is not used as a drug due to toxicity, and the oxacillin and dicloxacillin use mostly, and nafcillin is also used as less because of the toxicity too, but still nafcillin is not much toxic, but methicillin is very toxic. So then amoxicillin and ampicillin are also stable for the acids, and piperacillin and ticarcillin are also stable for the acid. So this penicillin V is stable for the acid, but only in high doses. So penicillin V actually is the modification of penicillin G that is not stable for the acid. So, and also from the right side there is a stability for the penicillinase. Penicillinase is the enzyme of the bacteria. So those bacteria that produce penicillinase, they will destroy penicillin, and then also the amoxicillin and ampicillin and piperacillin and ticarcillin. So actually only antistaphylococcal penicillins have a resistance for the penicillinase, and also the combination of the amoxicillin with the clavulanic acid and ampicillin with the sulbactam. So this clavulanic acid is the inhibitor of the penicillin, and sulbactam is also. And same as here, ticarcillin with clavulanic acid, same clavulanic acid, and piperacillin with the tazobactam. Also, these clavulanic acid, tazobactam, and sulbactam are the inhibitors of the penicillinase. So they are not antibiotics, so they are combined with the antibiotic. Like amoxicillin is the 850 amoxicillin plus 150 clavulanic acid. They have 1000. The dose is 1000 in one tablet. So this is a combination of two drugs in one tablet. So this is a combined agent, and they combine antibiotic with a penicillinase inhibitor. So that is for today. What are your questions? Baha, what are your questions?
No, I think everything okay.
So we need to know all the penicillin family and learn it by the heart, right?
Right.
And which diseases it work on.
Right. Especially.
And the chemical compound, we need to know it, or it's not so important.
You need.
No, we need to learn it by the heart.
Yes, chemical structure, but not of the every antibiotic, but only common chemical structure. So like this one. So this
Yes,
one.
okay.
You.
The second one,
This one. You learn only the common. Like all penicillins have this, but this R is different. This group is different, like amoxicillin, ampicillin. So you only learn this, and you should explain this is the beta-lactam ring, and this is a side chain. So this is will cleave it. It will be destroyed by the penicillinase.
This lecture is available on the website.
Sorry.
This lecture available on the website.
It will be available because I'm recording it now, and then it will be available several hours after.
I mean only the lecture. Can I take only the lecture, or
the lecture will be available, the recording?
Okay.
Including your questions, so and you will able to listen yourself.
Okay.
الحمد لله انت على خير.
انفضحنا
Everything
الأذان
you
ما
tell
لا
now will be published, so be careful.
Yeah, it's okay.
So, other
So,
questions?
no questions.
It's clear.
I have
على
question.
فضحتنا.
Bushra,
بشرى أشياء.
طلع المختفي.
Bushra, what is your question?
Joke comic. Excuse me about the ticloxacillin and nafcillin. Do you mean you said it's toxic? Do you mean it's not? It's effect with penicillin?
They
We
are
can.
penicillins themselves, like
They
methicillin.
made from penicillin.
Sorry.
They made from the penicillin.
Yes, they derived from the penicillin, so they have common structure. So, and I'm not sure if they are delivered. So if they are made from the penicillin itself, because I suppose there is a different way of the synthesis, but the chemical structure is common, and that is why they have the same pharmacological properties. But methicillin have a methyl group that is actually makes it more toxic, and it is toxic for the liver. So, and that is why nowadays it's only used as a test agent. So if you want to make a test for the activity of the antibiotic, like to see for this particular pathogen in your body, what antibiotic is more effective. So then you can take a smear from the physician will take a smear from you, and then send it to the lab, microbiology lab, and then 2 weeks after, microbiology lab will make a list of
And
the drugs that are more or less effective.
and penicillin only effective, or we can mix with them antibiotic. Another antibiotic.
No need to mix with another antibiotic.
So it's effective.
Yes, it is antibiotic itself,
الله حظك شي أمريكا عليه السلام.
but it is only effective against particular diseases. So you can only use penicillin.
And what if we have, for example, allergy of penicillin? How?
Yes, allergy is common, and
Yes.
in that case, you should not use a penicillin in the patient that is allergic to the penicillin, because that will
So,
lead to the death.
what should we use?
Then you should use other antibiotics that have the similar spectrum, like for example the erythromycin. So erythromycin have completely the same erythromycin. It's like we will study it next week. So the mechanism of action is different, the structure is different, but the spectrum is almost the same. So actually and also you can use another antibiotic that is more effective, like a wider spectrum antibiotic too. Like it can be more expensive and more adverse effects, but still you will not get allergy. So but take in mind that allergy to the penicillins is reported very frequently, and not every you have.
I have allergy. Yes,
How do you know?
because I made when I was born.
She made tests when we had practice class. تذكرين بشرى؟
No. It's allergy of والله.
شنو كم الرجي عندك انت؟
هو قاعد يحكي انت بتحكي على في الايمونولوجي مو؟
اي بس سويت لك كل الحساسيه بوقتها، قلت لك عندك بنسلين نستله.
I made test when
In
من
childhood?
كانت بلجيريا.
In childhood? When you
Yes,
was a
when she
child?
was in Algeria.
In a-
No,
لا عاد احكينا
In
بالعربي.
I
childhood,
did
right?
it when I was baby.
In
when
childhood.
yes,
Wow,
when you was
تعال
baby.
قلنا.
Okay. So Bushra,
Yes.
if this test is documented, then you have an allergy. But if test is not documented, if like your parents told you about that, but
No,
the physician told. Okay.
physician.
If
Yes, so and when we had immunology 2 years ago, and she made the same test, and she told her that she
Yes,
have allergy from
okay,
penicillin.
penicillin. So it's
she
very
just
common.
forget.
It's very common. So
Yes.
Bushra,
Yes.
attention please. When you have an allergy to the penicillin, you also have a cross allergy to the cephalosporin, carbapenem, and you cannot use.
Amoxicillin.
No, I mean
Amoxicillin.
not all. Amoxicillin is a penicillin.
Amoxicillin.
Like, let me show you.
Okay.
Can you see this? Can you see this?
No, sir, nothing.
No, I can
One-
see.
We can just see.
No, there is no.
Just your face.
One moment.
Even your face is gonna. It's bad.
One moment. Can you see
Mhm.
now?
Yes.
Wait
So,
a minute. Yes.
Bushra.
Ah.
So,
Yes.
do you see this? All these drugs are contraindicated for you.
Mhm.
All this.
Oh my god.
Oh.
بشرى انتحر احسن لك.
So, that
No,
is
I
why-
don't know.
Sorry?
Yes, I got it.
So, learn by heart
Not-
every
not
drug.
mine.
So, make sure you are not prescribed this one. Because if you will take any of these, then you will have an allergy. And then you can die from allergy.
Bushra, I will bring you a present for your birthday. I think it will be good to bring amoxicillin or ampicillin. Which one you like?
So,
Amoxicillin.
Okay, I will bring it with the big effect. So
Oh,
the best one.
so sweet.
so Bushra, now you have a good reason to learn the pharmacology to survive.
Yes.
So you survive and don't
بشرى
die.
يعني اذا تضوجيني يوم اخليك امبسلين بالشاي.
So any other questions?
No, thank
No,
you.
good. Then I think we can conclude. Thank you for attention.
So question,
and
a small question. So
see
what
you
will happen if
next
I
week.
will buy? يا كلب ما يسمعني. الو